There are no cases of known community-acquired COVID-19 confirmed in Lincoln or Nebraska at this time. You may continue to see media reports on maps that show 19 cases in Nebraska. These are, of course, the individuals who were brought here for quarantine and possible treatment at UNMC. However, confirmed cases outside of China are increasing exponentially. We are very concerned. It is likely that the virus will eventually be confirmed here. Our message today is that all of us, individuals, families, businesses, and organizations, need to prepare now for how we will keep the virus from spreading and how we will best protect ourselves, our families, and our community. Other communities outside Nebraska have closed schools temporarily and canceled events. We can't say yet whether that will happen here, but families in Lincoln need to get prepared for that possibility. Families need to be considering now what their plans would be in the future should schools and child care centers, for example, need to close. Earlier today, I met with Governor Ricketts and other state officials, including experts from UNMC, some of the nation's top professionals in infectious disease. They tell us that COVID-19 will have a significantly bigger impact in our communities than a normal flu season would. And that's because, as a novel virus, no one has immunity to it. And although work on a vaccine is being expedited, it still takes time. One of the important lessons learned from China's experience is that early mitigation is crucial and can have a positive impact in mitigating the spread of the disease. Early mitigation means taking steps to prevent the spread of the virus and can help to delay the peak of an outbreak. Instead of a sudden spike in cases, the spread is more gradual. That is very, very important to reducing the burden on our healthcare system and other infrastructure. An example of a community-based intervention and early mitigation technique is the University of Nebraska's announcement yesterday, University of Nebraska-Lincoln's announcement yesterday, that it is suspending university-sponsored student travel outside of the U.S. We are grateful to the university for their efforts to responsibly manage in a time of uncertainty, as early mitigation can have a positive impact on our community-wide response. The Lincoln-Lancaster County Health Department continues to do a great job serving as the lead agency in our community-wide preparedness efforts. Our interim director, Pat Lopez, attended the meeting with myself and other state officials today. Our health department continues to monitor the situation 24 hours a day, 7 days a week. We have measures in place to detect any cases quickly, to minimize transmission of the disease, and to guide our community's response. I want to stress that we will continue to share information and make sure the public has accurate and up-to-date facts and the guidance they need to make their plans. The most timely and accurate information is available on the city website at lincoln.ne.gov. Earlier this week, our health department also set up a hotline for questions about COVID-19. And so far, about 50 people have used that resource. The hotline number, once again, is 402-441-8006. We will also continue to hold community briefings like this one as they are needed. If our local situation changes this weekend, we are prepared to have a timely briefing, and we will send a notice of any briefing at least several hours in advance. At least that will be our goal. If we need to, we will do it in a moment's notice. The public will be able to view all the briefings live through Link TV. The briefings are also available on the Link TV YouTube site that has a closed captioning option. I want to thank Sharon Sinkler, our interpreter for the deaf and hard of hearing, for working with us today. Our health department began working with community partners on preparedness several weeks ago, and that planning continued this week. At this time, Pat Lopez, our interim health department director, will update us on those efforts and the current situation. Pat?
Currently, there are 99 cases in the United States. We've had 10 deaths confirmed, and we now have 14 states involved. And Colorado was added since we had a briefing this morning where they have 2 cases, one that's confirmed and one under investigation. Washington State reported an additional death for the 10 total, and California reported their first. The total number of deaths due to coronavirus, to the best of our knowledge, is now 11. The New York Times reported 150 confirmed cases in the United States. So at this time globally, there are 95,333 confirmed cases and 3,282 deaths, according to the World Health Organization. So the commitment and dedication of our great public health partners in protecting our community is evident. Earlier this week, our training center hosted nearly 150 healthcare professionals representing 60 healthcare facilities, including hospitals, long-term care, EMS, first responders, home health, and outpatient surgery centers. They all attended with short notice and participated in an exercise to share information and improve preparedness across the healthcare network in our community. Also this week, the health department convened over 30 school administrators representing Lincoln Public Schools and 10 other public and private Lancaster County schools. This group is very engaged in reviewing existing plans and preparing for the possibility of a local community level outbreak. We are also meeting with early childhood care professionals next week for those facilities to learn more and for us to learn about their potential concerns and be able to provide assistance in their preparedness planning. The health department will continue to reach out to the community and provide guidance in what can be done to prepare for a potential outbreak.
I want to thank the members of our medical community for joining us again today. If they could please come forward from the Lancaster County Medical Society, Joan Anderson. From Bryan Health, we have Russ Gronwald and Lisa Vale. CHI St. Elizabeth's Derek Vance and Tim Plant are here. And if I don't have everyone's name, please, if you are here to speak to this situation as a member of our medical community, please come forward. Okay, please.
Thank you, Mayor. I'm Joan Anderson with the Lancaster County Medical Society. We're the physician organization, and I just want to assure everyone Lincoln is probably in a better position than many communities across the state because we are so connected with our communications. With the hospitals, surgery centers, physician's office, long-term care, all of those that Pat mentioned as far as participating in the tabletop exercise, we are connected electronically, so we get emails at least on a daily basis, sometimes more often. We don't have to wait to listen to CDC to know things are happening. We get it from the health department or the CDC itself. That connectivity also allows us to share best practices. So for example, our physicians' offices are already communicating about what changes are you making. The first change they're making is in the triage system in their phone calls. So for example, if you call into your doctor and say, you know, I've had sinus infections, I think I have another one, I need to come in, it won't be as simple as scheduling an appointment. They may need to ask you more questions. Have you traveled? Have you been around people that have traveled? Or they may ask you to allow them to have a nurse call you back. So that'll be huge because, as the mayor said, our major effort in keeping this as minimal as we can is to do this triaging and preventiveness and that kind of thing. So I think it's just important that you know we work very closely with everyone, and the health department is a great leader. They let us know what we should be doing, when we should be doing it, and how we should be doing it in most cases.
Hello, Lisa Vale from Bryan Health. I'm here with Larry Krebsbach, our Infection Prevention Manager. I just want to let everyone know that we continue to participate with the Lincoln-Lancaster County Health Department as well as the Nebraska Hospital Association in our efforts to be ready for whatever might happen. This week we've participated with both of those conversations and stay abreast with what's happening almost on a daily basis, monitoring CDC reports as well as the local status. process. One of the things we have done recently this week is to just do an in-depth evaluation of the supplies that we have so that we are going to be ready, should we need to be, for respiratory type isolations should an individual arrive at Bryan with this type of process in place where we want to evaluate them for COVID-19. I would like Larry just to speak on a couple of moments about what the best strategy is for coming to the hospital should you believe you need to be evaluated for a possible COVID-19 infection. Larry, if you would, please.
So our strategy for managing patients is really simple. We try to identify. So part of our whole screening process is we look at the symptomology that CDC publishes, the travel history. Everyone that enters the facility is screened with those criteria. If someone is identified as a potential patient that we need to test for that, we immediately isolate those individuals. The mask goes on that patient. We start precautions for healthcare workers. And at that point in time, we inform. In other words, we call the Lincoln-Lancaster County Health Department, work through the case with them. Is this an individual we need to test or not? And then once we get direction from them, we either are going to test or we go to the next step, which might be the fact that they don't meet the criteria and they can safely go home, or they might end up going home with certain restrictions. So that's kind of our internal process that we're following for managing the patients.
Hello, I'm Tim Plant. I'm representing CHI Health St. Elizabeth and CHI Health Nebraska Heart Hospital. And without repeating everything Lisa said, we also are following those same guidelines and maintaining a high degree of readiness. And we are ready to take patients that may present with these symptoms with COVID-19. We also have been doing a check of our supplies to make sure we have enough, and drilling through patient surge processes to handle a higher amount of patients than what we normally see on a day-to-day basis.
Thank you.
We said we would give you accurate and up-to-the-date information. We have just received word from the governor's office that a case of coronavirus has been diagnosed in Omaha. It is a person who is related to travel. And that's what I can tell you right now about that incident. Our health department is also working closely with Lincoln and Lancaster County schools and colleges, and I want to at this time invite representatives of the educational institutions to come forward. LPS Representative Eric Weber, Dr. Steve Joel is with us, and from UNL, Josh Davis, the Director of International Engagement. Thank you for being here today.
Thank you, Mayor. So first, I'd like to reiterate what previous speakers have mentioned, and that is that I feel like we as a city will be extremely prepared for whatever is forthcoming. I want to thank the mayor. I want to thank Pat Lopez. The communication has been absolutely incredible. We feel like we're in the know. Certainly this is unprecedented for a city, probably for the country, but we will develop plans that will meet this challenge. Having said that, I'll tell you that we're on spring break as of 4 o'clock today, which I thought originally was good timing with regard to what was happening. I think it's good timing because we'll have an opportunity to really put forward some plans. In the event that schools have to be closed, which I hope isn't a likelihood, but we have to plan for that possibility, we are equipped to do remote learning. Our technology infrastructure would support that very well. With regard to free and reduced lunches, which is such a big part of many of our families' existence, we're working on some plans to create some grab and go opportunities. There's a lot more planning that has to take place. We'll use next week to finalize those, but we stand ready to be assistive in any way that we can, and we understand that as districts around the country, particularly right now, I think in Washington area, Seattle, Washington area, the closing of institutions really is a key to mitigating the severity and the prolonging of this virus. So I appreciate very much being involved in this planning, and we stand ready to assist any way we can. And I know that, again, I have great confidence in the folks in this room to be able to meet this challenge head on.
Hello, my name is Josh Davis. I'm the Associate Vice Chancellor for Global Affairs at UNL. And at UNL, we continue to closely consult with public health professionals here in the state and to closely follow the CDC's recommendations in order to make sure that our community remains protected. As the mayor said, we've already taken a number of pragmatic steps that many other universities and colleges across the country have taken, and we've suspended all of our upcoming university-sponsored travel for our students outside the continental United States and Hawaii for the remainder of the spring semester. Students already overseas are being permitted to remain in those locations as long as the countries that they're in remain below the CDC 3 level warning. We're evaluating whether to extend this cancellation into the summer, and we hope to make that decision in the next few weeks. We've also asked our faculty and staff to carefully consider whether their travel, either domestic or international, is essential or might be delayed to a later time. And finally, we've established a COVID-19 task force that's evaluating additional steps that we might need to take in the coming days or the coming weeks. And we've also established a UNL website to keep our campus and community updated, and that's covid19.unl.edu. We very much appreciated the close collaboration with the city, with the county, and with other key partners, and that's certainly the spirit that we intend to work in as we move forward. Thank you.
The health department is also continuing to work with our business community, and we have again here with us today from the Chamber of Commerce, Todd Wilchin.
Thank you, Mayor, and again, thank you, Pat, for your leadership. I'd echo what Steve Joel mentioned, that their work last few weeks has been remarkable, and the Lincoln business community is very appreciative of their work. Following up on our efforts from last Friday, the Lincoln Chamber, with coordination from the Lincoln Lancaster County Health Department, we continue action alerts through electronic communications and social media channels for our members. We have linked to the Lincoln Lancaster County Health Department website to our website, lcoc.com, and we encourage members who have questions about preparing their businesses and their organizations to go to that website, where they can have more resources to learn about how to prepare for the eventual virus in our community. On Wednesday, Chamber President Wendy Birdsall encouraged business leaders to lead by example and alter their greeting habits by discontinuing handshakes. Also on Wednesday, Pat Lopez and Tim Timmons joined us at our monthly Chamber Coffee, where they briefed attendees on the status of the coronavirus, sharing their message of remaining calm, staying informed, and being prepared, for which we are very grateful for their work. The Chamber will continue including the Lincoln Lancaster County Health Department staff in our briefings during our forums and meetings for the foreseeable future. Thank you.
We appreciate the business community's effort to lead by example and ask them to continue to encourage employees to stay home if they are sick and to be as flexible as they can be in allowing work from home options. Getting information out to all our residents is extremely important, and I want to recognize the representatives of our cultural organizations who are here with us today. Do we have from the Asian Cultural Center, is Sheila Dorsey-Vinton here? From El Centro de las Americas, is Romeo Guerra here? The Good Neighbor Center, do we have Tom Randa? The Malone Community Center, John Goodwin. From the Ponca Tribe, Suzanne Mueller. Thank you. 1 out of 5. But we will make sure that we are in swift communication with them about today's briefing for those who are not here. The City of Lincoln also has an incident command system that we use for events like the Lincoln Marathon or the Uncle Sam Jam and emergencies like flooding that happened last spring. That system provides us with an efficient structure to guide our preparedness and response and to make sure all parties are at the table. We have now implemented that system with our health department as the lead agency. It's not something that the public will notice, but it is another internal tool to optimize our response. We want to again stress to the public that the common sense actions we all can take to reduce the spread of any respiratory virus. Wash your hands often with soap and water for at least 20 seconds. And if soap and water are not available, use an alcohol-based hand rub with at least 60% alcohol. Cover your nose and mouth when you cough or sneeze, and avoid touching your eyes, nose, and mouth. Protect your family, friends, and coworkers. If you are sick, stay home and limit contact with others as much as possible. And again, employers, please encourage sick employees to stay at home and try to provide flexible work options for them. Finally, stay informed. You can find accurate and up-to-date information at lincoln.ne.gov. Keyword health, and our hotline number again is 402-441-6008. Another update I received from my chief of staff is that the confirmed case of COVID-19 in the Omaha area was related to travel in someone who had traveled to the United Kingdom. Before we take questions, I want to again express my appreciation for the collaboration and communication we are seeing across all sectors of our community. We are deeply, all of us, deeply committed to the health and safety of our residents. Questions? Yes.
What level of confidence do you have in the information being shared from the top level down in the health community?
What I would say is that we are relying here in Lincoln on our local leadership from the Lincoln and Lancaster County Health Department. I'm incredibly confident in their leadership and coordination. We were just marveling the other day about, press conferences like these normally would take a long time to pull together, but because of the relationships that all of these organizations have with our Lincoln Lancaster County Health Department, we are able to come together. These relationships are strong, they're solid, and they are at work for our residents. Yes?
When did you learn about the confirmed case? Just now?
Just now.
Maybe a question
Yes.
for Pat.
Yes.
How long does testing take to come back with a result, positive, negative?
Usually when the tests are done right now at the public health lab at UNMC within 24 hours.
Are there enough tests in Nebraska right now, say a large outbreak should occur? How many tests does UNMC have?
I can't answer the number of tests they have, but we have been able to test those that need to be tested now. And we're on the verge of probably an announcement next week that there'll be a larger number of tests available. And we'll be posting that when we have the accurate information.
When do you recommend people should go in to get tested? Just with cold-like symptoms, or should you wait until you develop more flu-like symptoms?
I think a lot of people think they have like a sinus infection or a respiratory infection, so they wait a little bit. But if you actually have a fever, a cough, and kind of respiratory symptoms, we'd like you to call your provider and call them ahead, like Joan Anderson mentioned from the Medical Society, so they can give you the best guidance about coming in.
Did you have another question?
Has the city undertaken any measures to sort of prepare for if there's you guys are working remotely, more friendly now because you're on the cloud, but are you guys taking steps to prepare for the need to have your staff or employees in the departments work remotely?
Yeah, last week we gave the direction to all department directors to update, if they need to, their continuity of operations plans, because we want to make sure that vital city services, essential services, are in place for our residents. Other questions?
I have a question. I know the information is kind of new right now, but do you know if that patient that just got confirmed, are they being quarantined at home, at UNMC, any kind of information like that?
Right now, since I was standing in here, I'm not sure what the status is, but I know there'll be information coming out if they're quarantined at home. It's possible that they could be, so they're not out in the community, but not knowing their health status, that would really dictate what measures should be taken.
It's my understanding the governor's office was doing a media briefing during ours because the case came up. So someone else at your outlets is probably on that call with the governor. They'll have more information about that particular case.
Any other questions? All right. Thank you. We'll continue to keep you informed with the up-to-date information we have available to us, and we appreciate your presence here today.